Welcome to the Polk County Health Department's Bloodborne Pathogen Training. In this training, we will cover the following topics: hand hygiene, a review of universal precautions, what to do if you experience a bloodborne pathogen exposure, and how to report an exposure. Hand hygiene is the most important mechanism to prevent the spread of disease. It is vital that employees perform hand hygiene anytime they are providing patient care, using the restroom, when coughing or sneezing, and one time that's often forgotten is following the removal of gloves. The Wisconsin Department of Public Health recommends the use of alcohol-based hand sanitizers as the preferred method of hand hygiene in the healthcare setting. The exception to this recommendation would be visible soiling on the hands. In that case, soap and water would be the preferred method. When using hand sanitizers, it is important to ensure adequate coverage of skin, to rub the solution over the skin for at least 30 seconds, and to allow hands to dry prior to resuming your work. When using soap and water for hand hygiene, it's important to scrub adequately for a minimum of 15 seconds to all hand surfaces, to rinse with fingertips pointed downward, and after drying your hands, to use a clean paper towel to turn off the faucet. Bloodborne pathogens that are of greatest concern to healthcare staff include hepatitis A, hepatitis B, hepatitis C, and HIV. Hepatitis A is spread through fecal-oral transmission. And while hepatitis A has an extremely low fatality rate, it does cause significant illness that may last anywhere from a few weeks to a few months. Hepatitis B is transmitted via blood, or OPIM, which stands for other potentially infectious materials. It is a very hardy virus and can survive for up to 7 days in a dried medium of blood or other body fluids. Hepatitis B can result in either an acute infection which resolves or in a chronic disease state. For those who develop a chronic infection, the disease can lead to premature death due to cirrhosis or cancer. The good news regarding hepatitis B is that it is a vaccine-preventable illness. Hepatitis C is also transmitted via blood, or OPIM. Unfortunately, there is no vaccine against this type of hepatitis. Complications of hepatitis C are the most common causes of end-stage liver disease necessitating transplant. It is an insidious disease due to the fact that approximately 90% of those who become infected remain asymptomatic at the time of infection. The rate of progression into chronic disease is estimated to be between 50 and 80%. And those who do develop chronic disease, 50% will develop cirrhosis and/or liver cancer. HIV, the virus that causes AIDS, is also transmitted via blood and OPIMs. Symptoms of infection are vague and nonspecific, so the diagnosis is often not made until secondary illness points to the presence of the disease. So how do we ensure our safety and protect ourselves from the development of these diseases? Universal precautions is the set of standards that the CDC gives us to properly protect ourselves. Under universal precautions, all blood and certain body fluids, or OPIMs, are considered potentially infectious. We no longer rely on the premise of an individual's perceived risk or known test result. Rather, we take appropriate safety measures to protect ourselves all the time. These protections include the routine use of gloves, appropriate hand hygiene, and expanding our safety net with the use of masks, protective eyewear, face shields, gowns, and aprons as needed. Proper handling of sharps is another vital component of universal precautions. The use of puncture-resistant sharps containers, the absolute contraindication of recapping needles, and the mandatory use of safety devices keeps us all more safe. Our behavior in the workplace also affects our risk of exposure. Eating, drinking, handling contact lenses, applying makeup, or any other actions that cause us to be in contact with our mucous membranes should never be done in any location where there is the potential for contact with blood or other OPIMs. Also, we should never be storing food or beverages in any location where specimens are stored. Now we will review the guidelines of how to manage an occupational exposure if one does occur. Not all exposures pose the same risk. Factors that affect risk include the prevalence of infection among our population, the type of virus that you are exposed to, and the type of exposure that you suffer. The Polk County Health Department Exposure Control Policy encompasses employee education and training, work practice controls, engineering controls, and record keeping. The purpose of the policy is to reduce bloodborne pathogen exposures and to protect staff during their employment with Polk County. Several terms in the policy are specifically defined for clarification purposes. An occupational exposure occurs during the performance of work duties. An exposure incident is a specific event that resulted in an employee exposure during the performance of an employee's duties. Other potentially infectious materials, or OPIM, is defined as any fluid or solid that is visibly contaminated with blood, and all body fluids when it is difficult to determine if they have blood in them. Post-exposure management includes several elements: wound management, exposure reporting, assessment of infection risk, appropriate treatment follow-up and counseling, rapid access to clinical care, and an injury prevention assessment. Wound management begins with the cleaning or flushing of the exposure site. Plain soap and water should be used for wounds, and copious amounts of water should be utilized in the flushing of mucous membranes. A risk assessment should be conducted by a medical provider or an infection control specialist. If appropriate, specimen collection will be obtained to test the exposed staff member as a baseline evaluation. The staff member should be counseled on post-exposure prophylaxis, signs and symptoms of acute infection, and the prevention of secondary transmission. Exposures must be reported as soon as possible to the employee's supervisor. Upon supervisor notification, the employee will be provided with the most recent CDC guidance on bloodborne pathogen exposure. Within 24 hours, the employee will be provided with assistance in scheduling a confidential medical evaluation. In conclusion, let's quickly review the main elements of exposure procedure. Number 1, clean wounds with copious amounts of water. Number 2, notify your supervisor. And number 3, meet with a medical professional.